Some nurses are textbook examples of what not to do. That is what Dr. Caldwell said 47 minutes before his entire career collapsed on live television. The night shift at Cedar Creek Medical in San Antonio hums with fluorescent buzz and antiseptic sting. Katie Rodriguez moves through the trauma floor like a shadow, silent, efficient, invisible. Her hands never shake during foreplacements. Her charting is flawless. But there's something wrong about the way she carries herself, too upright, too controlled, scanning exits like threat assessments. She limps slightly on her left side, an old injury she never discusses. The other nurses avoid her. She's too quiet, too intense, doesn't do small talk. When Dr. Caldwell arrives for his shift, he notices her immediately, and his eyes narrow with the particular cruelty of a man who has found his target. He had no idea that the unremarkable nurse he was about to destroy had killed men with her bare hands in 3 different countries. Grand rounds begin at 6:30 in the morning. 15 residents trail behind Dr. Caldwell like disciples following a prophet, clipboards clutched, eyes eager to absorb the wisdom of a man who has convinced himself he is infallible. The fluorescent lights above cast everything in pale clinical white. Katie stands at the edge of the group, reviewing vitals from the night shift on a tablet. Her scrubs are pressed. Her badge is clipped precisely at 90 degrees. She doesn't look up. Dr. Caldwell stops at bed 4. The patient inside is stable, pneumonia, responding to antibiotics, expected discharge in 48 hours. Routine. But Caldwell's voice takes on the theatrical tone of a man about to deliver a sermon. He gestures toward Katie like she's a museum exhibit of incompetence. "This is what happens when you follow the rulebook too literally," he says. The residents turn in unison. Katie continues charting. By the book rigidity. For placement textbook perfect, too perfect, if you understand me. No clinical intuition. No flexibility when a patient needs you to think, not just execute. He's never examined her for work. He's never looked at her charts. He's never asked her a single clinical question. Katie's jaw tightens almost imperceptibly. That's all. No flush. No tremor. Just a tightening so small that only someone trained to read micro-expressions in combat zones would notice it. Medicine isn't a checklist, Caldwell continues, his voice climbing slightly. He's looking for a reaction now. It's an art form. And some people, he glances back at Katie, simply lack the instinct for it. The residents laugh. Small, nervous laughs, the kind that come from junior staff who are still learning the difference between confidence and cruelty. One of them actually glances at Katie, as if checking whether she's aware of her own incompetence. Katie turns the page on her tablet. The gesture is so deliberate that it might as well be a slap. She's not dismissing him. She's not angry. She's simply treating his voice as background noise, the same way a trained operative treats the drone of helicopter rotors or the white noise fizz of a firefight in the distance. To her, this is nothing. An annoyance. Less than. Dr. Caldwell notices. His jaw hardens. He doesn't like being ignored. Narcissists never do. He moves to the next bed, still talking, still gesturing, but his eyes keep finding Katie. She's moved to the medication cart. Her movements are economical, efficient, precise. There's something in the way she handles the 4 bags, not like a nurse following protocol, but like someone who has done this under artillery fire, in a tent without electricity, in conditions that would make most people's hands shake so badly they couldn't hit a vein if their life depended on it. The rounds finish at 7:15. The residents disperse to their assigned floors. Dr. Caldwell vanishes into his office. Katie wheels the medication cart to the supply closet and begins restocking. Her hands move with the fluidity of muscle memory. 8 years as a Navy nurse practitioner in forward surgical teams in Baghdad and Kandahar. 3 tours. 2 medals for valor she'll never wear in public. 1 catastrophic injury that ended her military career 7 months ago, officially. Unofficially, she's here, at Cedar Creek Medical in San Antonio, on assignment from NCIS Special Operations Division. The tarnished challenge coin sits in her locker. It's small, the size of a quarter, made from aircraft wreckage and shrapnel welded together by the 160th SAW Night Stalker pilot she used to work with. Her call sign was engraved on one side by a man who's now dead, IED, Sanjin Valley, Helmand Province, 2019. She keeps it hidden. Behind spare scrubs. Behind the fiction that she's just another floor nurse named Katie Rodriguez from Corpus Christi with a nursing degree from a school that technically doesn't exist. She reaches into her locker. Her fingers find the coin without looking. The metal is cold and rough against her palm. She holds it for exactly 3 seconds, a ritual, a tether to the person she actually is, and then it disappears back into the shadows. Rodriguez. A voice from the hallway. Not Caldwell. One of the night shift nurses, an older woman named Patricia who's been at Cedar Creek for 19 years. You got a new admission. Trauma Bay 3. Medevac from Landstuhl. Army Ranger, complications from an extraction in Baghdad 3 weeks ago. Katie closes her locker. Her entire body goes still for a fraction of a second. Baghdad. 3 weeks prior. An extraction that didn't make the news. She's already moving before Patricia finishes speaking. What kind of complications? Katie's voice is level. Clinical. A nurse asking reasonable questions. That's the thing. The paperwork says shrapnel wounds to the left arm and shoulder. But the attending says the injuries don't match the narrative. Patricia lowers her voice, conspiratorial. He thinks the official report is sanitized. There's something else. Something they're not telling us. Katie is already walking. Trauma Bay 3 is 4 doors down. The patient is already being prepped, vitals being established, and 4-line being started by one of the younger nurses, a trauma surgeon reviewing imaging on a light box. The patient is male, mid-30s, with the unmistakable bearing of someone who's done this before. Soldier's posture. Soldier's eyes. Even horizontal on a gurney, he has that awareness about him, the particular tenseness that comes from spending years in places where relaxation gets you killed. His name on the chart is Marcus Webb. Rank, Staff Sergeant, Army Ranger, 3rd Battalion, 5th Marines. But Katie reads the real data immediately. The wound patterns don't match shrapnel. The scarring on his left side tells a different story entirely. Tearing. Impact. The kind of trauma you get when you're standing between a blast and your unit. When you're the one who takes the round meant for someone else. She's seen this before. She's created this before, stitched men back together in field surgical teams in Baghdad when the official story was never going to match the classified one. The trauma surgeon doesn't acknowledge her as she enters. He's focused on the imaging. Katie moves to the 4 bag. The placement is adequate but not optimal. She can see the error immediately, 1/10 of an inch too medial, which means the position will cause discomfort and restrict arm movement once Webb starts physical therapy. In 4 weeks, when he's trying to regain mobility, he'll understand why. Katie's hands move. She doesn't ask permission. She doesn't announce herself. She simply replaces the 4 with a confidence that makes the younger nurse step back. The needle slides in at precisely the correct angle. The tape follows in smooth, economical strips. Her fingers are steady as surgical lasers, which they should be. They've placed thousands of these lines, many of them during conditions that would make most people's hands shake so badly they couldn't thread a needle if their life depended on it. Staff Sergeant Webb's eyes flick toward her. Recognition isn't there, they've never met, but something registers. The competence. The confidence. The absolute absence of hesitation. His eyes narrow slightly. He watches her hands. He watches the way she moves. And for a moment, something passes between them. An acknowledgement that neither of them will ever speak about. Katie finishes her work and steps back. The trauma surgeon finally acknowledges her presence with a nod that might be appreciation or might be dismissal. It's impossible to tell. She returns to the nurse's station. Her assignment is already waiting in her secure email. NCIS has flagged Marcus Webb as a person of interest connected to a classified DOD operation that went sideways in Baghdad. Surveillance parameters are minimal. Monitor his intake. Record any statements he makes. Flag any attempts at communication outside the hospital. And under no circumstances reveal the true nature of your presence. Your credential as a floor nurse is your cover. Everything depends on it remaining intact. Katie reads the message 3 times. She deletes it. She returns to the medication cart, and her hands continue their work, distributing pills, checking dosages, maintaining the fiction that she's simply a floor nurse named Katie Rodriguez doing her job at Cedar Creek Medical in San Antonio. But her left hand, the one still holding the phantom weight of the tarnished challenge coin, trembles slightly. Not from fear. From something else. The particular tension that comes from having already survived the worst and knowing that the worst is about to walk through the door again. The fluorescent lights hum. The monitors beep their steady rhythm. The hospital breathes around her like a living thing, unaware that its newest nurse is a decorated Master Chief Petty Officer with 3 Purple Hearts and a Silver Star, standing in the shadows where she belonged. The monitors beep their steady rhythm. The hospital breathes around her like a living thing, unaware that its newest nurse is a decorated Master Chief Petty Officer with 3 Purple Hearts and a Silver Star, standing in the shadows where she belonged. But shadows don't last forever at Cedar Creek Medical. It starts during grand rounds on a Wednesday morning. Dr. Caldwell sweeps through the trauma floor with 15 residents trailing behind him like goslings, and Katie is positioning an 4 on a post-op patient when his voice cuts through the hallway. Not addressing her directly. Not yet. Notice the technique here, Caldwell announces, gesturing at Katie's setup with the casual cruelty of a man who has never questioned his right to humiliate. His voice carries the distinctive tone of someone performing for an audience, each word shaped for maximum effect. This is what we call by-the-book rigidity. Observe how Nurse Rodriguez follows protocol so slavishly that critical thinking becomes impossible. Paint-by-numbers nursing. Competent on the surface, utterly incapable of adaptation. The residents shift uncomfortably. A few smile, the kind of nervous laughter that comes from watching someone stand alone in a spotlight they didn't ask for. Katie's jaw tightens imperceptibly. The only visible reaction, the muscle alongside her temple contracts for half a second, then releases. Her hands continue their work. The 4 drip adjusts smoothly. She charts the vitals with the kind of measured precision that belongs in an operating theater, not a hospital floor. Her face shows nothing. She doesn't look at Caldwell. Doesn't acknowledge the residents. Doesn't defend herself. The silence of someone who has learned that words are currency, and she is saving hers. Caldwell watches her closely, searching for a crack. Some sign of embarrassment. A tremor. Something. Katie finishes her notation, caps her pen, and moves to the next patient without ever meeting his eyes. The residents follow Caldwell down the hallway, the moment already dissolving into hospital routine. What Caldwell doesn't understand is that he has just watched a Master Chief Petty Officer maintain operational composure while being publicly dismantled in front of 19 witnesses. This is called staying in cover. This is called the kind of discipline that gets soldiers home alive. 2 days later, Katie is at the vending machines near the staff break room. The fluorescent lights buzz overhead with their electric hum, casting everything in a sterile white that makes the world feel smaller than it is. She's retrieving water for a patient when Caldwell appears with 3 interns in tow, their clipboards clutched like shields. Rodriguez. His voice arrives before his body does. This for placement on bed 6 is amateur hour. Katie extracts the water bottle and turns to face him. The interns cluster behind Caldwell like remora fish, waiting to see what happens. Did you even pass your clinical boards? Caldwell continues, his tone designed to carry through the break room, or did they lower standards for you? The interns exchange glances. One of them, a young man with acne scars and expensive shoes, actually smiles. Katie considers him for exactly 1 second. Just one. Her eyes are grey-green like the Atlantic in winter, and the look she gives him contains multitudes. It's the look of someone who has seen men die. Who has held intestines together with her own hands. Who has called in fire coordinates while bleeding from shrapnel wounds. The look doesn't last long enough for Caldwell to process it fully, but it's long enough for him to feel something primitive shift in his chest, a warning from the older parts of his brain, the parts that still understand predators. Then she returns to adjusting the drip rate on the nearby forestand, her movements precise as surgical instruments. Each adjustment made with absolute certainty. No hesitation. No doubt. Caldwell stands there for another moment, then turns back to his residents. "Let's move," he says, and his voice has lost some of its edge. The interns follow him, their confidence visibly deflated. One of them glances back at Katie. She doesn't notice. She's already moved on to the next task, because that's what soldiers do. They adapt. They continue. They don't waste energy on people trying to break them. Later that week, Katie is in the ICU checking on a post-op Army Ranger named Marcus Webb. He was medevaced from Baghdad 3 weeks ago with injuries that don't match his official report. Multiple lacerations on his left side. Partial pneumothorax. Contusion patterns that suggest he was shielding someone from shrapnel. His chart says motor vehicle accident. Katie knows better. She doesn't ask questions. She monitors. She watches. She waits for whoever wants him dead to make their move. Webb is still groggy from anesthesia when Caldwell finds Katie at the bedside, checking the chest tube and recording vitals. The monitors hiss softly, the sound of oxygen pumping into compromised lungs, the sound of survival measured in milliliters per minute. This is an authorized presence, Rodriguez. Caldwell's voice is quieter now, but harder. More dangerous. He has moved from mockery to something else. Something with teeth. Residents handle post-op ICU rotations. Floor nurses don't have ICU privileges. Katie doesn't pause. She finishes recording Webb's respiratory rate, 16 breaths per minute, steady, within normal range, and turns to face Caldwell with absolute composure. "I should have security escort you out," Caldwell continues, his voice dropping lower so that only Katie and Webb can hear. "Maybe that's where you belong. Behind a desk. Nowhere near actual patients." Webb's eyes narrow slightly, tracking the dynamic. He watches Caldwell with the focused attention of someone trained to read threats. Then he watches Katie, waiting to see how she responds. Katie nods once. Just once. A simple acknowledgement that requires no words, contains no defiance, offers no opening for further assault. She returns to the monitors, checking the oxygen saturation, 94%, holding steady, and continues her work as if Caldwell has already left the building. He stands there for several seconds, frustrated. The silence stretches. She has refused him the satisfaction of a reaction. No tears. No anger. No defensive explanation. Just a nurse doing her job with the kind of focus that makes it clear he is background noise. Caldwell eventually walks away, his posture tense. He has been dismissed. Not with words, worse than that. With simple, absolute indifference. Webb watches him go, then studies Katie with new understanding. The monitors continue their steady rhythm. The foot drip continues its precise work. Katie finishes recording vitals and moves to adjust his pain medication dosage, 2 milligrams of morphine sulfate, when Webb speaks quietly, his voice still rough from the breathing tube. "That's a Kandahar splice," he murmurs, referencing a battlefield technique Katie had used during an equipment delay to stabilize his chest dressing. A technique not taught in civilian nursing schools. A technique developed by combat medics in the mountains of Helmand province when equipment failed and soldiers were dying anyway. Katie's eyes lock on his immediately. Her right hand moves to rest on the forestand, and her gaze carries a message so clear it might as well be written in field manual language: silence. Operational security. Not here. Not now. Webb nods weakly, understanding passing between two people who have seen what others have not. He closes his eyes and doesn't ask again. Katie continues her work, her hands moving with mechanical precision. But something has shifted. Webb knows. And more importantly, Caldwell is getting closer to discovering what Katie is. The operation is still secure. Her cover is still intact. But the clock has started ticking, and she can feel it like a second heartbeat in the room. She charts the final vitals, her pen moving across the paper in neat, precise letters. Behind her, the monitors continue their hiss and beep, the sound of a patient saved. The sound of a secret held. The sound of time running out. The alarm screamed at 2:33 a.m. Not the routine overhead page. The cardiac monitor alarm, the one that meant someone's heart had stopped filling with blood. Katie heard it from the supply closet on the trauma floor where she was restocking chest tubes, and her body moved before her brain caught up, muscle memory taking over from 1,000 nights in Baghdad when the difference between moving fast and moving slowly was measured in body bags. The code was Webb. The ranger who'd watched her splice the chest tube 3 days ago. The one who'd murmured Kandahar like a prayer and then fallen silent when her eyes warned him to stop talking. She was at his bedside in 19 seconds. The attending physician, Dr. Morrison, was already there, a competent surgeon in his 50s who moved with the practiced efficiency of someone who'd trained at trauma centers where the bullets were real. But his face had gone pale. Webb's vitals were collapsing. BP dropping like a stone. Heart rate 148 and climbing. Oxygen saturation plummeting from the moment the shift nurse had noticed him struggling to breathe. He went from stable to this in 4 minutes, the night nurse said, voice shaking. I don't understand. He was fine. His post-op labs were perfect. Katie glanced at the monitor. Muffled heart sounds from the assessment. The kind of quiet that meant blood was pooling somewhere it shouldn't be. Her hands moved, pulling the portable ultrasound from the wall mount, smooth, no hesitation, and within seconds the image told her everything. Pericardial effusion. Massive. The fluid was compressing Webb's heart like a fist squeezing a sponge. He was in tamponade. The pressure was killing him. He needs the cardio team, Morrison said, already reaching for the phone. Pericardiocentesis. Stat. But Katie was already looking at the clock on the wall. 2:54 a.m. Cardio was 15 minutes out minimum. ETA closer to 20. Maybe 25 if there were delays. And Webb's oxygen saturation was at 71%. Dropping. His blood pressure had fallen to 82/48. His skin was the color of wet concrete. He had for minutes, maybe 5 before his heart stopped completely and all the interventions in the world wouldn't matter anymore. The attending saw her expression shift. Saw her eyes move from the monitor to the crash cart to the ultrasound screen and back again, calculating. We can't, Morrison said, not unkindly. The cardiologists need to. No time. Katie's voice had dropped an octave. This was her voice now, the one that had ordered corpsmen to hold catheters steady while artillery shook the forward surgical tent. The one that had told SEALs to hold still and breathe through the pain. I can do this. I've done this. The words hung in the air like a grenade with the pin pulled. She felt them land. Felt Morrison's sudden stillness. Felt the night nurse stare at her like she'd just grown a second head. But there was no time for explanations. Katie was already tearing open the pericardiocentesis kit, a needle kit that wasn't in her authorized scope of practice, that no floor nurse had any business opening, much less using. The kit contained a 14-gauge needle attached to a catheter, the kind that was meant to slip between the ribs into the pericardial sac and draw out the blood that was suffocating the heart. The kind that took a surgeon to deploy safely. The kind that required authorization codes and attending signatures. Katie had neither. Webb's oxygen saturation hit 63%. His eyes fluttered open, unfocused, confused. He was losing consciousness from hypoxia. Katie prepared the site with a speed that made Morrison step backward, the antiseptic swab, the local anesthetic, the ultrasound probe positioned to guide the needle between the 5th and 6th ribs, just below the xiphoid process. She could feel the pressure beneath her gloved fingertips. Could feel where the needle needed to go, like she was reading Braille written in blood and anatomy. Her left hand was the ultrasound probe. Her right hand held the needle. She didn't speak. Didn't explain. Didn't ask permission. She sank the needle in at a 45-degree angle, feeling the resistance of tissue giving way, feeling the membrane of the pericardium giving way, feeling the hiss of air escaping, the sound of pressure releasing, the sound of a life not ending today. Blood flowed into the catheter barrel. Dark blood. Old blood. Tamponade blood. The color of hemorrhage that had been sitting in Webb's chest cavity, pooling, compressing, killing. Katie held the syringe steady as the blood drained, as the pressure in Webb's chest released, as the monitor's frantic alarm slowed from a shriek to something almost human. Webb's oxygen saturation climbed. 65, 72. 79, 88. His blood pressure rose with each milliliter of blood drawn. His heart rate dropped from 148 to 132 to 119. The muffled heart sounds became clear again. Strong. Steady. Alive. Sinus rhythm. 68 beats per minute. Perfect. Katie's hands didn't shake. They never did. Not in the forward surgical tent. Not in the combat hospital at Bagram. Not in a trauma bay at 2:57 a.m. with an attending physician staring at her like she'd just performed a miracle in front of 1,000 witnesses. She secured the catheter to Webb's chest with the same precision she'd used to fold flags at military funerals. The same precision that had held sutures steady while Marine Corps surgeons worked and artillery thundered outside the tent. Then she stepped back. Webb's eyes opened fully. He looked at her. His lips moved, barely a whisper. Nightingale. She shook her head once, a gesture that said, "Don't speak, don't move, don't acknowledge anything you think you just saw." But his eyes held hers for a moment that felt like stopping time. He knew. He'd seen the Kandahar splice 3 days ago. He'd heard the voice that ordered him to be still and breathe. He'd just watched someone extract blood from his chest with the kind of calm that came from having done it before, in places where there were no surgeons and no attending physicians and no authorization codes, just hands and knowledge and the will to keep people alive. Morrison still hadn't moved. The night nurse had her hand over her mouth. The monitors beeped their steady, normal rhythm. Webb's chest rose and fell with air that was actually reaching his lungs now. The cardiac tamponade was reversing. The pressure was gone. He was stable. Katie turned to Morrison with her face absolutely neutral, her composure a wall of stone. "Cardio team can take it from here." She pulled off her gloves and disposed of them with the same care she'd used for everything else. "I'll chart the procedure." Morrison's mouth opened. Closed. Opened again. Did you actually just? "I'll be in the staff break room if anyone needs me," Katie said. Her voice had returned to the register of a floor nurse, but something essential had changed. Something about the way she'd said it made Morrison's instinct to question her shut down cold. This woman had just performed emergency surgery. This woman had just saved a life that was medically forfeit 60 seconds ago. She walked from the trauma bay with her hands steady and her heartbeat normal. The challenge coin pressed against her ribs where it lay beneath her scrubs, tarnished and heavy and the only proof of who she actually was. She'd done it. She'd performed a pericardiocentesis with an ease that would raise questions. She'd used equipment that wasn't in her scope. She'd taken command of a crisis like she'd been trained for exactly this moment. She had been trained for exactly this moment. But that wasn't the worst part. The worst part was that she'd done it in front of Dr. Caldwell's favorite attending physician. Morrison was going to talk. Morrison was going to report what he'd seen. And somewhere in a cold house in the San Antonio suburbs, Dr. Caldwell would be getting a phone call that would make him smile in a way that looked like a shark smiling at blood in the water. Katie sat in the break room that smelled like stale coffee and the ghost of 1,000 overnight shifts. She opened her locker. The challenge coin lay there where she'd tucked it among her spare scrubs and her false identity documents and the fabricated nursing school diploma that had gotten her through the credentialing process at Cedar Creek. Tarnished. Dented. Earned through 12 years of service that no one here could ever know about. She didn't take it out. Didn't touch it. Just looked at it and thought about exposure and mission failure and the sound of Webb's heart finding its way back to normal rhythm. 2 hours later, at 5:14 a.m., Dr. Caldwell walked into the trauma bay. His eyes found Katie immediately, standing over Webb's chart, monitoring his post-emergency vitals, her composure a perfect replica of medical professionalism. Caldwell's expression shifted. Predatory. Like he'd just figured out what the sound in the walls actually was. True heroism is what you do when the world stops watching. Dr. Caldwell arrived at the trauma bay 7 minutes after Webb's vitals stabilized. His shoes clicked against the tile in that specific rhythm Katie had learned to identify from 40 feet away, the gait of a man expecting to deliver bad news. She was still standing over the patient, the unauthorized needle kit laid out on the metal cart beside her, the pericardiocentesis catheter coiled like a snake she'd just disarmed. Webb's oxygen saturation sat at 94% and climbing. The cardiac monitor showed normal sinus rhythm. The man should have been dead. Instead, he was breathing. Caldwell's eyes moved from Webb to the equipment to Katie's hands, which were still steady, still clean, still positioned with the kind of precision that belonged to someone who'd done this more than once. His face didn't flush. His voice didn't rise. That was somehow worse. The silence stretched like a taut wire between them, and in that silence, Katie watched something crystallize behind his eyes. Not suspicion. Certainty. Step away from the patient, he said. Not a request. A command. Katie moved. She was trained to move. But in that moment, as she stepped back from Webb's bedside, she understood the equation had shifted. The equation had failed. Caldwell had seen what her hands knew. What her body remembered. What no floor nurse at Cedar Creek Medical should have been able to execute in the dark, alone, with equipment not designed for the procedure she'd just performed. He didn't touch the needle kit. He photographed it with his phone. Then he turned and walked out. What happened next unfolded with the mechanical precision of dominoes falling. Caldwell had spent 3 years cultivating allies, hospital administrators, board members, physicians who owed him favors. He placed his first call at 11:53 p.m., waking the board president's wife, who handed the phone to her husband with the irritated efficiency of someone accustomed to late-night hospital emergencies. Caldwell's voice in that phone call was a calculated instrument. Respectful. Concerned. Professional. He didn't accuse Katie of anything. He simply asked questions. Questions that seemed innocent on the surface but carried the weight of someone who had already decided on the answers. I'm looking at credentials for one of our newer nurses. Catherine Rodriguez. RN license through Texas Board. I'm wondering if you could confirm her graduation from the University of Texas at San Antonio, class of 2022. I've got some discrepancies in her nursing school references, and I want to be thorough before we bring this to the board. The board president, now awake and alert to the possibility of liability, promised to follow up immediately. Caldwell had already made 2 more calls before midnight, to the fabricated nursing school that didn't exist, to the clinical supervisor Katie's file claimed she'd worked under in Houston. Both calls went to numbers that routed to dead ends. By 1:15 a.m., Caldwell had summoned an external investigator from the Texas Medical Board. He did this through an official channel, submitting a formal complaint about potential credentialing fraud. His voice on the phone to the investigator was concerned, measured, the voice of a vigilant physician protecting patient safety. I'm not making accusations, he said, the words precisely calibrated. I'm raising flags. There are procedural inconsistencies that need to be reviewed by someone with authority. What he didn't say, but implied with every careful pause, I have already caught her doing something unauthorized, and I have the documentation to prove it. The investigator assured him that a preliminary review would be conducted within 24 hours. By 3 a.m., Caldwell had informed hospital administration. By 4:30 a.m., Katie was pulled from the trauma floor by 2 security officers and an HR representative named Janet who wouldn't make eye contact. The charge nurse didn't say goodbye. The residents who'd gathered at the nurse's station to watch Katie's removal kept their eyes on their phones. No one spoke. No one needed to. The message was already in motion. Whatever she'd done, she was being erased. The citation was written with corporate precision: patient endangerment through unauthorized medical procedures. Credentialing violations. Use of hospital equipment outside the scope of practice. Potential fraud in submission of credentials. Effective immediately, pending investigation. Security cleared her locker in front of her and released her personal belongings: a spare stethoscope with a military-grade carabiner, 2 protein bars, and the tarnished challenge coin, which she pocketed before either of them could ask what it was. "You'll be contacted by the board investigator," Janet said, finally looking up. "You can't re-enter this facility during the investigation. If you attempt to—" "I understand," Katie said. Her voice was steady. Her hands were steady. But something inside her was collapsing like a building being demolished from the foundation upward. She left Cedar Creek Medical at 4:47 a.m., walking through the pre-dawn darkness toward her vehicle, the smell of hospital antiseptic still clinging to her hair, her skin, her clothes. She didn't go home. She couldn't. Protocol was clear: exposure meant failure. Failure meant the operation was compromised. Failure meant Marcus Webb was still vulnerable, still a target, and she'd just eliminated the only person in this hospital who could actually protect him. She sat in her car in the hospital parking lot, watching the security camera feeds on her phone, feeds she'd tapped into 3 weeks ago on the first night of her assignment. She watched Caldwell leave at 5:17 a.m., shoulders back, probably already composing the conversation he'd have with the board about how he'd caught a fraud before she could harm anyone else. But that wasn't the worst part. That evening, Katie returned to Cedar Creek Medical one final time. Not to the front entrance. Not to any floor where she'd be visible. She went to the laundry facility in the basement, the one place where hospital staff deposited their scrubs after each shift. She hadn't removed her uniform when she'd been escorted out. She was still wearing the same blue scrubs she'd worn while performing the pericardiocentesis, while saving Marcus Webb's life, while unknowingly signing the end of her assignment. The laundry room was empty except for an HR escort who positioned herself by the door without speaking. Fluorescent lights hummed above like insects trapped in plastic. The air smelled like bleach and industrial detergent. Katie stood in front of the metal shelves where clean scrubs were stacked in color-coded piles, and she pulled her worn blue set from her locker. The fabric was soft from hundreds of washings. The neckline was stained with her own blood from a phlebotomy incident 2 weeks ago. She folded them. One sleeve across her body. The other sleeve parallel. The neck aligned. The waistband folded down to meet the collar. Each crease exact. Each fold precise. The way she'd folded flags at 3 military funerals. The way she'd folded her dress uniform the day she was discharged from active duty. The way you fold something when you're placing it in a coffin. When you're saying goodbye to a version of yourself that will never exist again. Her hands trembled. Not from fear. Not from shame. From restraint. From the effort required to perform this simple, devastating task without breaking every piece of equipment in this fluorescent-lit room. Webb was still in this hospital. Webb was still exposed. The person who was supposed to protect him had been erased. The intelligence operation she'd been embedded to complete was now in free fall. And she couldn't do anything about it. Couldn't reveal who she was. Couldn't explain what she was trained to do. Couldn't protect the ranger upstairs or the mission she'd sacrificed her medical discharge to pursue. She placed the folded scrubs on the metal shelf with the precision of someone handling ordnance. The HR escort cleared her throat. Katie nodded. She turned, walked past Janet without speaking, climbed the stairs to the main floor, and exited Cedar Creek Medical into the San Antonio night. Behind her, in the cafeteria, Caldwell was sitting with 3 colleagues, describing the moment he'd exposed her. "Some people," he was saying, his voice carrying the satisfaction of absolute victory, "don't belong in medicine. I just saved this hospital from a massive liability. She won't be touching another patient for the rest of her career." What Caldwell didn't know, military intelligence had already received notification that Nightingale's 6th cover was burned. What he didn't understand, the machinery of consequence was already in motion, and it moved at speeds that had nothing to do with hospital boards or Texas Medical Board investigators. What he couldn't have anticipated, a 6'4" man with a neck tattoo and stolen hospital scrubs was moving through Cedar Creek's back corridors, taking advantage of the chaos Katie's removal had created. That man was walking toward Marcus Webb's ICU room. And Katie Rodriguez was watching him on her phone, parked 2 blocks from the hospital, her keys already in the ignition, her training reasserting itself like a muscle memory she couldn't suppress. Her cover was gone. Her assignment was finished. But the ranger upstairs was still breathing. The night had 17 hours left. The lobby television flickered at 6:56 a.m. Local news anchor, professional smile, then a photograph, Katie Rodriguez, dark hair, steady eyes, younger in the image but unmistakably the same woman who'd walked out of Cedar Creek Medical yesterday afternoon carrying a paper box with her stethoscope inside. The headline crawled across the screen in white letters, "Decorated Navy Master Chief Missing After Undercover Assignment." The cafeteria fell silent. A nurse mid-bite set down her fork. 2 residents froze, coffee cups suspended. A custodian stopped mopping, the squeaky wheel of his cart becoming the only sound in the room. "That's her," someone whispered. "That's the nurse Caldwell fired." The anchor's voice continued, clinical and detached, Master Chief Petty Officer Katie Rodriguez, attached to Naval Intelligence Operations, was reported missing at 11:34 p.m. yesterday following what sources describe as a classified assignment at Cedar Creek Medical. The hospital has issued no statement, but Pentagon sources confirm Rodriguez held active top-secret clearance and was involved in a DoD counterintelligence operation. Her disappearance has triggered a full interagency. The automatic doors to the cafeteria slid open. Marcus Webb sat in a hospital wheelchair, still bandaged but moving with the deliberate precision of someone who'd spent his life training his body to obey him. His right arm was in a sling, his left hand gripping the armrest. Behind him, a veteran security guard, name tag reading Clayton, 23 years Cedar Creek, moved with the measured pace of someone who'd seen things that changed you. Webb's voice cut through the silence like a knife through gauze. "Nightingale 6. Clayton's spine straightened. His jaw tightened. When he spoke, his voice carried the weight of recognition that transcends words. "Master Chief Petty Officer Rodriguez. 3 Purple Hearts. Silver Star." He paused, then added quietly, "and a Navy Cross." The cafeteria erupted, not in chaos, but in the specific kind of stunned movement that happens when reality collides with what people thought was true. Staff members stood. Some phones appeared. A resident's hand went to her mouth. The lobby doors opened again, and this time, the air pressure changed. A 2-star general in dress blues entered with 2 aides flanking him. His uniform carried the weight of command, not because of the stars on his shoulders, but because of the way the space around him seemed to contract, as if the room itself acknowledged his authority. His eyes scanned the cafeteria, moving across faces until they landed on the television screen showing Katie's photograph. He walked to the screen. Didn't speak. Just stood there, studying the image with the intensity of someone reading a classified document. Then he turned to the gathering crowd and began to read, his voice steady as a metronome, "A Master Chief Petty Officer Katie Rodriguez. Enlisted 2009. 2 tours in Baghdad, Fallujah District and Sanjin Valley, Helmand Province. 17 confirmed life saves under fire. 2011 to 2014, assigned to JSOC Task Force 121 as Forward Surgical Team Lead. Architect of the Hemorrhage Control Protocol, now standard across CENTCOM. That protocol has saved 4,812 military personnel since implementation." He paused. The silence was so thick you could operate in it. In 2019, the general continued, his voice dropping lower. During Operation Eagle Talon in Loga Province, Master Chief Rodriguez took fragmentary shrapnel meant for her unit while conducting emergency field surgery on wounded Rangers. Saved 12 men. Cost her medical discharge and 3 years of recovery. He turned to face the room directly. That woman was conducting a classified operation on these grounds. And someone terminated her. Dr. Caldwell pushed through the crowd from the back of the cafeteria. His face was pale, not red, not flushed with anger, but the specific whiteness that comes from watching your world detonate in real time. His mouth opened and closed. There must be some mistake. Her credentials were fraudulent. I was protecting patients. I had an investigator verify. You had an investigator, the general said, his voice carrying the glacial precision of someone who'd spent 30 years ending conversations, verify the credentials of an operative conducting a classified assignment. He turned to the hospital CEO, who'd materialized at the edge of the crowd like a man pulled toward a fire. This facility is currently being reviewed for breach of classified operations protocol. Federal agents will be here within the hour. Caldwell's hands trembled. I didn't know. There was no briefing. How was I supposed to? Exactly, the general interrupted. You weren't supposed to know. Which means you violated security protocol by investigating her at all. He turned back to the CEO. Recommend immediate suspension pending federal review. The CEO's face had gone the color of old bone. He was already calculating liability, insurance coverage, the legal catastrophe that was metastasizing across his hospital in real time. Dr. Caldwell, I'm going to need you to step into my office. Wait, Caldwell said, his voice cracking. Wait, I was just doing my job. The protocol violations were real. The pericardiocentesis was performed, a voice said from the crowd, by a Master Chief with 19 years of combat surgical experience. Under what would have been an appropriate medical emergency protocol if her credentials had been properly classified. Caldwell's face crumpled like paper. Someone began recording on their phone. News cameras from the VA partnership meeting, already present in the hospital that morning, swiveled toward the general and the crumbling cardiologist. Your credentials to practice in any DOD-affiliated facility, the general said, his voice carrying the finality of a gavel, are hereby revoked, effective immediately. Cedar Creek will follow suit or lose federal funding. The CEO didn't hesitate. Dr. Caldwell, you are terminated. Effective now. Security will escort you from the premises. Caldwell tried to speak. Nothing came out. Clayton, the veteran security guard, stepped forward with the quiet authority of someone who'd been waiting for this moment. He gestured, not unkindly, toward the exit. 2 other security officers appeared. Within 90 seconds, Caldwell was walking the same path Katie had walked yesterday, past the vending machines where he'd mocked her technique, past the bulletin board with the staff rotation, past the coffee station where she'd stood silent while he questioned her competence, with his credentials shattered and his career ending on live news cameras. The hospital fell silent again. Someone turned off the television. 6 months later, Katie stood in front of a strip mall on San Antonio's south side, the November sun casting sharp shadows across the parking lot. Through the window of Unit 7B, she could see a folding table with a cut-rate insurance banner. Behind that table sat Dr. Marcus Caldwell, and yes, it was him, even with the weight loss and the weathered face and the cheap suit that didn't fit right anymore. His hair had gone gray at the temples. His hands moved with the jerky precision of someone who'd stopped believing in precision. Katie didn't break stride. Her new Cedar Creek Director of Trauma Services blazer caught the sunlight as she walked past. Her ID badge swung slightly, and there, in the laminate, the tarnished challenge coin gleamed. No longer hidden. No longer a secret. The coin that had come back from a FOB in Loga Province, bent and scarred and carrying the weight of 12 Rangers' names she'd never spoken aloud. Caldwell looked up as she passed. Recognition flickered across his features like a candle in wind. His mouth opened slightly. For a moment, just a moment, he seemed like he might call out. Then he saw the badge. He saw the coin. He saw the way she walked with the absolute certainty of someone who'd earned the right to command every room she entered. Katie didn't acknowledge him. Didn't slow down. Just continued on, past the insurance table, past the folding chair, past the man whose entire life had become a footnote to her vindication. Webb had texted her that morning from deployment in Kandahar a photo of 2 junior rangers performing a modified resuscitative endovascular balloon occlusion of the aorta, REBOA protocol, the one Katie had designed and refined across 17 emergency procedures in the field. The ranger's hands were steady. The technique was flawless. Lives would be saved using her methods. The assassin she'd neutralized, 11 seconds, one perfected takedown, had given intelligence everything needed to roll up a network targeting wounded soldiers heading to aid stations. Her mission wasn't just about Webb's recovery. It was about every ranger that network would have killed. At Cedar Creek, she'd revolutionized the trauma program. The ICU now integrated combat casualty care protocols into standard training. Residents competed fiercely for shifts under her supervision. The ranger who'd said Nightingale 6 that morning was back on active duty, his cardiac function restored, his loyalty to her proven and eternal. In her office, the office with the nameplate reading Katie Rodriguez, Director of Trauma Services, Master Chief Petty Officer, U.S. Navy, she kept a framed news clip bookmarked on her computer. The moment Caldwell's world ended. She didn't watch it often. Didn't need to. Justice wasn't always about satisfaction. Sometimes it was just about being exactly who you were trained to be, regardless of who was watching. On her desk, she had engraved a quote, "True heroism is what you do when the world stops watching." Every night, she did her job, saved lives, trained surgeons, occasionally met a veteran patient's eyes with knowing recognition that required no words. One soldier to another. The tarnished coin caught the light from her office lamp as she reviewed the night shift assignments. 17 trauma cases projected for the week. 17 opportunities to prove that quiet competence, maintained under impossible pressure, ultimately transcends ego and cruelty. The fluorescent lights hummed their constant fluorescent song. Somewhere in the hospital, an alarm chimed, a monitor reading vital signs of another life she'd helped preserve. This was her kingdom now. Not the hidden assignment, not the classified operation. Just the raw, honest work of keeping people alive. If you've ever been underestimated by someone who didn't know your true value, you understand Katie's journey. Subscribe for more stories of quiet heroes who change everything. Like this video, comment below, have you ever judged someone only to find out you were dead wrong? And hit that notification bell so you never miss another story that reminds you, the ones who matter most often walk among us in silence.